Hi, good day. My name is Dr. Radley Ramdan. I'm a naturopathic doctor and acupuncturist. I'm here today to talk about post-traumatic growth, healing, healed, and growing. As we all are aware, PTSD Awareness Month is this month of June. So I decided to take an opportunity to talk a little bit about post-traumatic growth. Before we jump into post-traumatic growth, I want to talk a little bit about what is trauma. So trauma is, on a simple term, something that happens to us that throws us off our normal self. It creates a certain reaction within us that in itself is not a normal reaction to ourselves. And sometimes we get stuck in that place of the trauma. A lot of times we overlook things like stress and trauma, and then we start doing things like comparisons and saying, oh, maybe this is not supposed to be traumatic or this is not supposed to be stressful. But what is important to understand is that everyone's experience is completely different. It is important to understand that at the end of the day, the biggest thing is our perception in a given moment is whether something will be traumatic to us or will it be stressful to us. And this is where individuals sometimes differentiate, and you could see a group of people together experiencing the same exact thing, but one individual may end up developing something like PTSD. So again, as we bring awareness to the topic of PTSD, I really want us to understand that trauma really is what happens to that individual in that moment, and how does that individual actually interpret everything that is going on around them. So with that being said, I'm going to move on now. So, what happens when we experience trauma? Sometimes, like the little seed in the corner here, we feel buried. We go through dark phases of isolation and blaming ourselves, or we even go through phases of just blaming others, right? Sometimes we have anger, irritability towards others, towards the world, or even towards ourselves. We start looking inwards and trying to figure out, like, well, did this happen because of what I did? Did this happen because of what somebody else did? And then just like we start blaming ourselves, we start internalizing that anger. We start saying, all right, well, it's our fault. So we take the anger out on ourselves, or we blame someone else. And then we say, well, we need to be negative, or we need to exhibit that irritability and anger towards other people. Some people go through fear and anxiety. Some people go through shock, disbelief, numbness. Some people experience things like sadness or grief. Most times when we go through trauma, we don't usually feel our normal selves. And this is where, when within our natural ability to go through things, our body has that fight or flight response. And when we go through a traumatic event, sometimes we get stuck in fight or flight. And this is where we now start not feeling our usual self. Once we get stuck in that position, now we feel like we start getting disconnected or we feel lost. So there are a lot of different things that could happen to us when we do experience trauma. Um, it is important, again, to understand that different people experience trauma differently. So they could be very physiological or psychological reactions. Some people are affected with sleep. Some people's heart rate goes up. Some people have changes in appetite, changes in diet, etc. So it is important to understand everybody's reaction to trauma could be different. And again, it is based on how does that individual experience that or perceive their experience during that given time. That could also affect the way that they would react. After trauma, what we do is what matters, right? Do we let our trauma now define us? Or do we give ourselves the room to allow light in? Do we take an opportunity to reach out for help? Do we take that opportunity to say, oh, I experienced this traumatic event. I am no longer who I used to be before. I am now this new person that needs to be locked away, or I need to be angry, or I need to be sad. And then you start justifying all of these little things that have changed in you and change in terms of negative things. We start allowing those things to define us. So now everything else that we experience in the world now becomes based off of that trauma. as opposed to taking an opportunity to just allow light in, allow help to come to us, and then we could break that cycle of being fight or flight. So when we allow trauma to define us, we really get stuck in fight or flight, and we continue being in that survival mode basically all the time. So it is important for us again to find ways to break that cycle. How do we get out of that traumatic state, or how do we get out of fight or flight? So again, when we allow the light to reach us, we could transform our dark spaces into our growth space. So this is basically where we allow light in terms of allowing help. Sometimes help comes from people offering help, and sometimes it's us really just having to say, listen, I know I feel different based off of the traumatic event. I feel that I'm not my normal self, and I want to change. I want to get back to feeling somewhat like I used to before, or be able to do things that I used to before. Because within that trauma and within being stuck in fight or flight, oftentimes we get into that place of where things that we enjoyed doing in the past are no longer exciting to us. So we lock ourselves from those things that we enjoyed, things that we liked doing before. So again, once we allow that light in, we allow that help in, we allow that dark space that we kept ourselves because of the trauma, and we actually have that opportunity to convert those dark spaces into something more of a growth space, basically. So, what is post-traumatic growth? It's a positive psychological change or transformation that occurs basically after we go through some type of challenging life crisis. So again, that trauma, once we experience that trauma, we go through that phase of being stuck in fight or flight. And then post-traumatic growth is, what do we do after that? Are we staying in that same place? Are we being stuck as the seed under the ground and not actually taking an opportunity to grow? Or are we getting that positive changes and transformations within our lives, breaking out of that seed, basically forming roots and forming shoots, basically, and then allowing ourselves to grow as time go along? So it is important to understand that in post-traumatic growth, it's not necessarily a return to our previous normal, but there has to be some type of dynamic change in our life, the way that we view life, the way that we function in our everyday. Without having some type of drastic change or dynamic change in our life, we haven't really experienced post-traumatic growth. So sometimes people go through trauma, but they go back to their regular life. They haven't been significantly affected by trauma. And the only way to have post-traumatic growth, not saying that somebody who isn't able or who is able to just pick themselves up after experiencing some type of trauma, that it is not healthy, because that shows a degree of really resiliency that happens with them. But here we are talking more about someone who has gone through the struggles, who has struggled with getting out of that, get stuck in a dark place, went through all the negative experiences of things, and are trying to come out of that and make changes in their life. So again, it is people who have had that challenge and that very deep crisis that now, because of that crisis, they have to have some type of dynamic change. So they change the way that they do things, they change the way that they see the world, they change the way that they understand things. Because now you being at your darkest point in your life and you trying to come back out to a place of more light should create some type of impact, should be showing that, like, hey, listen, there is something very, very different that has happened here. And now I could see what it was with me being at my darkest point versus what it takes me to now shift out of that mindset, what it takes me to flip the script, basically, flip everything that is negative that is going on in my life. How do I start seeing things that are positive changing in my favor, basically? So it is not necessarily a quick change, but rather it's a process and a progressive change. So it is important to understand that post-traumatic growth takes time. It's not something that we just wake up one day and say, oh, I went to a psychologist, or I went and I reached out to help with a mental health provider, or I talked to friends and I just automatically change. sometimes people need to just break things down, get in, get deep, connect to their inner self, and really dig themselves back out. Sometimes it's taking everything negative, and there's this story that they talk about a horse or a donkey that had been fell into a well basically, and the owner was trying to bury the donkey, and all the donkey did is every time the sand fell on his back, he shook it off, and then he eventually had basically a stepping stone that allowed him to get back to the top of the well. So sometimes that is what post-traumatic growth entails. It takes time, it takes hard work, it is a progress. And sometimes we do feel that there is trauma, we do feel that we are re-experiencing things that we have faced. So taking that into consideration, it is important that we see that side of it where it's not a linear scale where it just goes from being bad to being good. We go through those waves of like we have a really good day and then suddenly you have a bad day or you feel like things are stepping back. But through that phase is where you have that growth. Through that phase is where you take that opportunity to say, I could fight this, I could get through this, I could keep pushing myself and I get through it. So again, using the seed and a shoot and root forming out, you go from that dark place of being stuck inside the seed. Now the shoot breaks out, it's still within that soil. It still has to take time for it to get above ground where it could actually see the light. So even though there is growth, sometimes we feel like we're still stuck. Sometimes we feel we're still buried. So once we understand that it does take time, it is a progressive change. It is something that it's a process rather than just a straight road. It's a wavy road. It's a um riding waves on the sea, however you want to describe it. It's not just an easy go sometimes. Some people, like I said, some people are lucky that things could change very quickly for them. They could adapt very quickly. And that is based off of the resiliency that they have had prior to their traumatic event. So again, it is a lot of different things when it comes to post-traumatic growth that we need to take a look at. Um, so Richard Tedeschi and Lawrence Calhoun are both psychologists that came up with these five core areas of shift that you see in post-traumatic growth. So one is personal strength. You start seeing a change in how do you feel as an individual? How do you view yourself, your strengths as an individual? Another aspect of it is deeper relationships. You start realizing, okay, now I actually form a stronger bond with some of the people that have helped me through things. I form a deeper relationship with even people that have experienced similar trauma to what I did. So sometimes you see bonds like in the military, people who have been through traumatic events together, they tend to form bonds. Um, People who are going through natural disasters together and they experience the same thing at the same time. Sometimes they form those deeper relationships because now they could relate to each other on a deeper level. They understand each other's trauma and they have that opportunity to grow together. It is also even for people outside of those that have experienced trauma because your shift, your change in perspective and things, you start having a deeper appreciation for everything in life. And that's basically number four, right? Appreciation for life. You have a very different view on what life is. You have a very different view of what it means to be alive, basically. And because of that, now the relationship that you create, you want to have something stronger. You want to have something where you value more. So again, that is another core area that you will see shift with post-traumatic growth. Also, seeing new possibilities. It's a big thing when it comes to that shift because when you're stuck in fight or flight, you basically have screens on where you could only see in one direction. You could only see one thing that is going on. It's difficult for you to see anything else that is going on in your life. So sometimes new opportunities pops up, new things pops up, an opportunity to develop a relationship is there. But because you're stuck in fight or flight, it's difficult for you to see those things. So when there is post-traumatic growth, it becomes easier for you to see or observe these new possibilities, those new opportunities. And then you yourself start creating new possibilities, new opportunities. You take an opportunity to be like, well, I didn't think I could help somebody else in this way. I could share my story and I am able to create an impact with somebody else. I could talk about things that I have done. I could find a way to create something different that if somebody has to go through something similar to what I do, there is a way or there is a possibility that that person may not have to suffer what I went through. So new possibilities is another core area of seeing changes. Again, we touched a little bit on the appreciation for life. Once you go through a traumatic experience and you have that phase where, all right, now I survived something that it's life-threatening. Some people go to the extreme of saying, that's it, I survived this one time, so now you're stuck in survival mode where it's like, I am willing to continue taking risks where my life is threatened. So you do extreme things. Sometimes you go into extremes of things like skydiving, things like driving faster, or you take risk and you become a high risk individual at that point in time. When there is post-traumatic growth and when you break out of that survival mode, your appreciation for life becomes deeper. It comes to the point where it's like, I am actually grateful to be alive. I see things differently. I start being grateful for the smaller things of my life. And you start having a broader view of things. Then you realize, like, listen, life is not just about me anymore. What I do creates a response with everybody else around me. And you start looking at little details that you may have taken for granted before. And you start appreciating those little details that are there within your life as well. And then one of the other core areas of shift that you see in post-traumatic growth is the spiritual or existential changes. So that is where, as you start getting that deeper appreciation for life, you start connecting to that bigger world. You start saying to yourself, all right, maybe it was God that saved me. Now I have to give back. And you start living a different life. Or you start connecting to the universe and you say, like, all right, well, maybe there is a purpose behind me surviving my trauma. What am I going to change or what am I going to connect to that I live with a higher purpose? I change. I start going to church, temples, almost. I start connecting to the universe. I start appreciating the little things that are there from the universe, and I start giving thanks back to the universe in that case, or even if you're religious or spiritual in that case, giving thanks back to God and saying, all right, I see. And then you try to share those experiences, you try to share those connections of how did that change. So again, these are just five core areas of shift that you would see in post-traumatic growth. It is not the end all be all, and it doesn't have to be only these things, but these are five main things, like I said, described by these two psychologists um, in the past. So now that we understand what it is, what it feels like to have post-traumatic growth, the big question is, what do I do to get there? How do I get there? How do I experience post-traumatic growth? And these are some of the things that I have used myself. These are some of the things that I've used with patients while working through their traumas, and I've shared with patients. I've shared in different talks that I've done. Um, Starting with number one, and I've mentioned it before, gratitude. Gratitude is a big part of post-traumatic growth, and it is a big part of getting to post-traumatic growth. When we start giving gratitude, when we start being thankful, the more thankful we are, we start seeing that rewiring in our brains to start to look for more things that we should be thankful for. Naturally, with society, sometimes with the way life is and the medias that are around us. Negative news always finds a way to sell more. We tend to crave negative and we tend to seek out negatives a lot faster than we do positive changes within our lives. And all of us are guilty of it. Even myself, sometimes you get caught up in that negative thing. and you get caught up in like, all right, just going down that rabbit hole of like, this is what bad has happened to me today, and this is what bad happened to me today, and then you forget all the other good things that has happened to you. So once you start breaking out of the habit, there's this saying that says, what you look for, you typically find. So when we start working on gratitude and we do gratitude exercises and it becomes part of our daily routine, then it becomes easier to find something to be thankful for. So whenever I do talks, I always like using my own personal experiences and sharing things with people so that they could understand I'm not just sharing from a point of doctor just sharing information. I'm sharing some information of things that I have tried, things that I have seen, and some of my own personal experience. And to also help people understand that trauma and stress and all of those things could happen to anybody. It is part of life. And just like you go through stress and trauma, you could also go through and achieve post-traumatic growth. So with gratitude, one thing that I do is I look for like small little things that I would have taken for granted that I notice in a day that it's different. So instead of saying, Lord, thank you, or thank you to the universe for having a shelter, thank you for something big, um, I go into smaller details like sometimes I have had health issues that have been restricted that I am unable to do certain things. And each time I get closer and closer to doing more than I used to before, I say thank you for being able to do something more. Thank you for being able to wash dishes today. Thank you for being able to leave home and come back home safely. Thank you for family. Thank you for um, a conversation that I had with somebody today. Thank you for a patient that came in and helped me see a different perspective on life or helped me understand something differently. So the idea with gratitude and being thankful is looking at the little things that are changing in our lives. And the more we take an opportunity to look at just those smaller things, the bigger things that we always take for granted, it's we it becomes easier and easier for us to say I am actually seeing more positive changes in my life because the bigger things we could be like, all right, yes, I'm thankful for having a vehicle, I'm thankful for having a shelter, but those are things that have been there before. Those are things that are more standard sometimes. And when we only look at the bigger things, we miss an opportunity to be grateful for the little things that are creating changes within our lives. So that person that made a difference in your life, I'm grateful for the person that stopped on the road to give me an opportunity to come out from a side road. I'm grateful for the person that stopped for me to cross the road. So sometimes when we take opportunity to see those little things, the impact that those little things have had on us would help us to start changing more and more and seeing more and more positivity within our lives. One of the other things that I use is forgiveness. Whenever I talk about forgiveness, I look at forgiveness in um, basically three different ways, right? One, it's forgiving um, somebody else, basically. So if something happens to you, you forgive somebody else. If you have committed the wrong, then the second aspect of forgiveness becomes where now I ask for forgiveness. And then the third aspect of forgiveness, which I think is something that people struggle most with, is forgiving ourselves. So just like I talked earlier, that within experience and trauma, sometimes we go through phases of guilt and we start blaming ourselves or we start blaming other people, especially blaming ourselves if we don't take an opportunity to forgive ourselves for what we interpreted or the way that we perceive something happening, then we hold on to that. And that is something that when we could forgive ourselves, when we could forgive our younger self for whatever it is that we held on to, it gives us an opportunity to basically let go of that. Um, and it is something that takes time. It is something that takes work to get done when it comes to forgiveness. It's not just waking up or doing an affirmation one day and saying, listen, I forgive myself for holding on to X, Y, and Z. I forgive myself because I didn't know better. right? It takes time, it takes work. It's a process of doing it over and over and repeatedly until you actually get an opportunity to do it. And you would feel the difference when you know you have forgiven yourself for it. And again, understanding that trauma is something and the way that we perceive it in that given moment of when that incident happened is what changes our dynamics, right? In terms of how we view that incident, how we view everything else. And when we put that blame on ourselves because it's a past version of ourselves, we have to take that opportunity within forgiveness to say, I forgive my younger self. So a trauma that happened to you when you were 25 and you're 35 now, you say to yourself, like, all right, I forgive my 25-year-old self. And I forgive my 25-year-old self for holding on to this, which is no longer serving us purpose. We take what it meant from that, whatever it is, whatever traumatic experience. It's not saying that we don't validate that we experience trauma. We take an opportunity to say, yes, whatever I experienced was traumatic, but it is not something that should hold us back. It is not something that should keep us buried. So I forgive myself for holding myself back from making changes. And that's where that growth phase comes in. Where do we take responsibility in what we are doing and what we have experienced? And again, talking about experiencing something in a given moment is whether our body says traumatic or not. Basically, it is because everything that we go through in life up until this given moment is what shapes the way that we would perceive the next thing that happens to us. So if at 10 years old you experience something, you look back at it and be like, oh, well, that wasn't as traumatic as I thought it would have been. But it is something that I held on from 10 years old till I'm 50 years old and saying, like, okay, well, in hindsight, this is something that really is not that big. I held on to anger because someone yelled at me or someone did this or someone did that. And yes, in that given moment, to you at 10 years old, you're like, well, that's the worst possible thing that could happen to me. So that's where you start holding on to those trauma, you start holding on to those things. And then you get older and you're like 50 years old and you say to yourself, well, it's something minor compared to everything else that is going on outside in the world. So again, when it comes to forgiveness and forgiving yourself, it's part of that is understanding that when we experience trauma, when we interpret what trauma was or what is traumatic to us, it's based off of everything that we have experienced in life up until that point. And with post-traumatic growth, it takes time to get there. So within that time frame, it's you now understanding that the trauma has happened, I have experienced it, and that's the best that I understood of it in that given moment. Now, today in 2026, June, I am no longer the same person that I was 15 years ago, or 20 years ago, or 25 years ago, because now I have had different experiences in life that allows me to change, allows me to have a different perspective on life, have a different experience, have a different appreciation for life. Those same cores that we talked about, new opportunities, new perceptions, all of those things. So once we forgive ourselves, we have that opportunity to break loose of that connection and that extra weight that we carry around in what I like to describe as basically an invisible backpack. It gives us an opportunity to free ourselves from taking that extra weight into the future. Time chunking is also another technique that I have used for myself and I share it often with people. I don't know how else to describe it beside time chunking just because it's something that I sort of utilize for myself. And time chunking is where you try, after a traumatic experience, you lose perception of everything else around you sometimes when you're stuck in that fight or flight moment. Time becomes an abstract thing to you at that point in time. And you go through phases of, all right, I want to give up. I don't care anymore, and all of those things. So time chunking is basically breaking time down into something that feels more manageable for you. So, for example, you get a traumatic or you go through a traumatic event, you lose somebody, or you get diagnosed with something that is life changing to you, or you experience some type of natural disaster, or you some other traumatic event, whatever it may be, and you're there and you're like, all right, well, I'm now in survival mode. Time chunking is saying that all I need to do is get to another point in time. So time chunking is making it more manageable. So I let's start with the January 1st, right? Everything happened and you're currently on January 1st. Um, Time chunking is saying on January 1st, all I want to do is I want to get to tonight, the night of January 1st. And then you just work towards, all right, I just need to survive until then. I need to do what I need to do to feel safe or to feel comfortable to get till the night of January 1st. When you get to that now, it's like, okay, I feel a little bit more comfortable. Then I could expand my time out. So it's like, okay, well, I want to get to January 5th because there is a friend's birthday or a family member birthday. And you utilize that to say, okay, my next time chunking, it's a matter of 4 days. So for me, it's like, okay, whatever I experience, I feel like I could manage getting through 4 days of whatever stress, whatever pain, whatever trauma that I'm experiencing. I could manage 4 days to get to the next point in my life. And that's my goal, just to survive till I get to January 5th. When January 5th come, so like, all right, well, I made it here. Now let me see what else I could look forward to. So it's like, okay, February is Carnival. Let me just try to get to Carnival this year. So you build yourself up and you take it in a manageable way. It's like, all right, my goal is to get to Carnival. I get to Carnival, and now it's like, okay, well, I'm feeling more comfortable. I'm starting to let go. I'm starting to notice changes within myself where I don't feel overwhelmed. I don't feel burdened by everything else that is going on. So now it's like, okay, I could expand my time out. Or you might come to Carnival and something else happens, and it's like, okay, I don't feel like I could push it a whole month away. Now I need to go from Carnival Monday to Ash Wednesday. So I bring it back down from a month to 2 days. So time chunking is just finding what is feels like a manageable amount of time that you could push yourself without falling into the trap of going down a negative rabbit hole. And it's not saying that if something negative happens or you start thinking negative thoughts means that you necessarily going backwards. It's like, okay, I need to catch myself doing it. I understand. I need to take time to understand why am I going down that thing, that negative rabbit hole, and then say to myself, okay, let me experience what emotion needs to be experienced. If it's grief because I remember the loss of a family member, or if it's anger because I'm frustrated about something that had happened to me in the past, then that's fine. Allow that emotion to be channeled out and let it come up. Allow yourself to process whatever that anger is. I mean, whatever that emotion is. And once you do that, it helps you to continue going into different segments of time. And then as time go along, you could start expanding the time, changing the time. So with time chunking, there is no set amount of time. It's whatever you feel like you need to tell yourself, I could manage to get from one time on a clock to another time on a clock, basically. So sometimes it might be like, all right, well, I just need to get through dinner. I just need to get through the night. I just need to get through a meeting. I just need to get through my doctor's appointment. I just need to get through the traffic that it takes to get from point A to point B. Or sometimes it takes bigger time periods where it's like, all right, I want to get towards my birthday, or I want to get towards a family member's birthday. I want to get towards a friend's event. I want to get to prayers. I want to get to Sunday so I could go to church or temple. I want to get to Friday so I could go to mosque. So again, time chunking is where you have total control. And that is what is important in post-traumatic growth is understanding what you could control, what you could manage. And because of that, it would start helping you make it easier to experience post-traumatic growth and to go through that phases of it. Self-talk is an important technique in achieving post-traumatic growth. What you say and how you say it is also important. So sometimes we tell ourselves or we hype ourselves up, just like sometimes people before they go to gym or before you're in a competition, you give yourself that pep talk and you build yourself up and you hype yourself up about something. It also reflects in the way that you say it when you're going through trauma, when you're experiencing trauma. If you say it to yourself, well, you know what it is. I'm having a bad day, and you start dwelling on it, and then you say, well, I feel okay, as opposed to saying, listen, today was a shitty day, but I learned and I have something to grow from it. Then the talk that you add into to yourself becomes different. What are you saying and how you're saying it now changes and adds in that positive switch to it. So when we do self-talk, it is important to understand what you're saying and how you're saying it and make sure that there is that positive ending to it. Um, in school, we talked about something called like the Oreo effect, right? It's basically, or the cookie effect. So it's the two ends of the cookies and the cream in the center. So you start with when you're doing self-talk is make sure you start with something that is positive. If there is something negative, make sure it's what is stuck in the middle, and then you end on something that is more positive again. So that's where at the end of it, the last part that your body remembers, the last part that your mind remembers really comes into that positive aspect of it. And that leads into the next aspect or the next technique. And sometimes I seem a little harsh with patients when I tell them, like, listen, you need to drop your negative handles with what you're saying or what you're doing. And sometimes they look at me like, what do you mean? And I'm like, well, I hear you saying X, Y, and Z, but you always add these handles in. So, for example, a patient comes in or an individual comes in and say, well, I see what you're saying. I want to make changes, but what if this negative thing happens? So once you start adding, but if this negative thing happens, then now you just basically, just like we were talking about with gratitude, I am only looking for something negative to happen. Not saying that it is impossible for something negative to happen or something bad to happen. But if we keep adding the negative handle at the end of everything positive, then you're going to keep experiencing more negative things within your life. So, for example, it's like you ask somebody, it's like, how you doing or how you feeling? They're like, well, I feel better, but the pain is still there. It's like, okay, for a second, drop the negative handle of the pain is still there and start saying, look, I feel better. Stop at that. Right. And the more we practice it, is not saying that we don't um or we don't understand or we don't say or we ignoring that the pain is still there or the negative thing that has happened is still there. It's taking an opportunity to start looking into what positive is changing. Again, like I said earlier, it is all about the more we look for something as the more we find it. So when we add the negative handles into things that we say to ourselves or to others, then it becomes easier for us to identify when those negative things are going to happen again in our life. So dropping the negative handle is to me, it's a big part of when you're going through post-traumatic growth and being able to experience post-traumatic growth. Once that negative handle is dropped, you have that opportunity to start seeing more positive things that are happening in your life. The next technique is something that a friend shared with me from school. Um, he always talked about using the affirmations of thank you, I love you, please erase. And this is basically you doing self-talk, you talking to yourself, you connecting to whatever trauma that you've experienced, whatever pain that you're experiencing, whatever the situation is, whatever health issues that you may have. This is basically talking to your subconscious and saying, thank you for who you are. Thank you for thank you for me being who I am with everything that is going on. And then by being grateful, you give yourself an opportunity to feel safer. Because when we feel safe, our body has a way of relaxing itself. And in a place where you give gratitude, it becomes easier to feel that level of safety. Next, when you say, I love you, it's like giving that extra comfort to yourself. So now it's like, thank you, I love you. Now I feel comfortable. Now I feel safe in the space that I am in. And then please erase is basically telling your subconscious to say, listen, we know what we have been through. We know what we held on to. We know what we are still holding on to. And we know what no longer serves us purpose. So please erase is telling ourselves, like, listen, I need to let go of what no longer serves me purpose. I need to let go of that which is something that I've been holding on to, and it's constantly keeping me stuck in fight or flight. So when we take that opportunity to do those affirmations, thank you, I love you, please erase, especially in that specific order, it's creating safety and now saying, while I feel safe, while I feel comfortable, I let go of what is things that I'm holding on to that might be creating any type of secondary issues for me. And again, it's even where there is aspects of where you see PTSD becoming the primary problem, and then secondary health issues developing around it. Sometimes people develop in cancer, sometimes people develop in heart problems, um, different diseases, stomach issues, different types of pain and stuff like that. Once you start working with that and you give yourself that comfort, you give yourself that safety, and you allow yourself to let go of things, you would see that change within yourself where you have that opportunity for growth. I added in the breathing exercise aspect of it because I feel like breathing is something that you could control. You can't control how quickly the second hand ticks on a clock. You can't control everything, so much other things that are going on. You can't always say like, all right, well, I could just press a button and my heart stops beating fast, or I change something differently, or I could just say like, all right, I just touch my leg and my pain goes away, right? It's me saying breathing is something that I know I could control. I could change how quickly I am breathing. It's something I could focus on and actively change in a given moment. And I have control of how quickly, how slowly I breathe, how much deep of a breath I'm taking, or how shallow of a breath I'm taking. So again, like I said, I talk from personal experience a lot of times. My friend shared that experience of that affirmation of utilizing it for myself. And I did it. Thank you, I love you, please erase. And I used to say it every single day in the morning and the night before I go to bed. Sometimes during the day, I would catch myself saying it. And then one day I was doing breathing exercises, and I'm like, maybe I should incorporate the breathing exercises with these affirmations. So each aspect of it, I take a deep breath in and a deep breath out. So when I breathe in and I breathe out, I say thank you. I breathe in and then I breathe out again, I say I love you. And then the third breath is like I breathe in and I breathe out and I say please erase. Again, this is not necessarily specific that you have to do it in this way. But I feel like when you focus on your breath and you focus on the control of your breath, it allows you to feel safe faster. And that's why breathing exercises in general is something that helps people get out of fight or flight quickly. It is something that helps people build resiliency. Um, so again, once you incorporate it, you have control of it, and that safety feels like it's there faster. You allow your nervous system to calm down, and you have that opportunity to maximize basically on the affirmation. So that's the way that I have utilized it, and I have seen it been helpful to others as well. Next is understanding our role in our healing process. So part of it does include things like those negative handles, the self-talks, but it also includes where do we stand with the trauma that we have been through? Are we in that phase of blaming ourselves? Are we in that phase of saying blaming others? Are we in that phase of saying, well, I just give up and I don't think there's any hope for me, and I just isolate myself from everybody else? So what role am I playing in my own healing process is important to understand. If you understand your role in it, then you could change what you could do differently to help you. So it's like, okay, my role in it is that every time somebody offers help, I put a wall up and I'm saying, nah, I'm fine. I don't need your help. Right? My role now says I become my own barrier to getting help in because the help is there. People are offering help, but it's me not wanting to reach out for help. So when I understand that that's the role that I have been playing in preventing my healing process from taking place, then now I could flip the script on myself and say, listen, I am the one that have been holding myself back from being able to heal. So now I have to make room when somebody offers help. I have to say, yes, I am willing to accept the help that you are offering and allowing yourself to take that and utilize it. And that touches basically on the last point, asking for help, allowing yourself to receive help. Once we understand where we are, once we understand our role, it becomes easier to ask for help, reaching out for help in dealing with trauma and stress and PTSD and healing from it. Again, it is understanding that it is a journey, it is a process, but it's also understanding that what may work for one person may not work for you. And what may have worked for one trauma that you've experienced may not work for another trauma. So it is important to understand that part of our role in our healing process is being open enough to say, listen, I used to go for talk therapy before and it worked. And now I'm going for talk therapy and it doesn't work, means that there is no hope for me. Our role in that is saying, no, listen, there is other options of things that we could try. There is different types of written therapy, there's expressive therapies, there is different types of, even with talk therapy, there are different types of talk therapy. Sometimes it might just be the practitioner or the healthcare provider that you're working with that maybe you're just not comfortable enough opening up with them or that specific one about whatever trauma it is, that now you need to shift in and ask for help from somebody completely different. Sometimes it's shifting and saying, I feel more comfortable with this one friend talking about X, Y, and Z, but I don't feel talk comfortable talking about A, B, and C with this friend. So maybe I have another friend who may be able to better understand my A, B, and C. So let me talk to that person instead, as opposed to saying, this is the one friend that I always confided in, or my family member that I confided in, and I've always felt comfortable with them, but now I'm not comfortable sharing with them. So now you lock yourself up. It's like, no, that's where you have to say, my role in this is now finding who else could get me the help that I need to, or finding what will work for me in that given trauma, basically. So again, understanding our role in our healing process, asking for help and allowing ourselves to receive help is important. A big part of post-traumatic growth is finding purpose and living with a purpose. I have had the opportunity to serve in the military. I've worked with friends in the military. I've worked with patients who've served in the military. And one of the biggest thing, if you talk to many of them across the board, when they come back home from deployment, one of the biggest struggles with feeling or reintegrating back into civilian life is that the sense of purpose isn't there. And not until you find something that gives you purpose that you feel that restlessness, you feel that discomfort, you feel the lack of safety being there. And you also see it with other patients as well that have experienced different things. But because of my experience with working with that population, that military background population, you see loss of purpose sometimes comes with changes in jobs, changes in environment, and you have to understand like, okay, well, what could I find as my new purpose? Or what else is there that even it might be still relating to the same thing. It might be relating to something that you've done in the past that you could say, my purpose of doing this is what makes me feel better or something that I do. And now I could shift it and do it here. This is another avenue of doing it. So finding your purpose, living with a purpose is a big part of helping with post-traumatic growth and being able to help you get through struggles. Same thing, telling yourself like, all right, what is the purpose behind the pain? Maybe I need to slow down. Maybe I need to change gears. Maybe I need to change directions. So finding purpose within our pain, sometimes it's helpful. Sometimes things that we love doing, we have to give up, but we don't have to give up every aspect of something because sometimes you might like being active in something and being a participant in a sport, for example. But now your purpose could be like, well, I can't actively play that sport. I can't do this, but I could potentially use an avenue of teaching this or coaching, and now it still gives you an opportunity to feel like I'm connecting to the sport, but now I have a different avenue or a different purpose of where I am expressing myself. So with that, it helps you again to find that post-traumatic growth, to be able to grow and stuff like that. So with post-traumatic growth, just like we started and I mentioned, the name of my presentation today really was post-traumatic growth, healing, healed, and growing, right? So there's three things that I want people to, or three quotes that I want us to close with today. And really, if it's something that you take away from everything, um, start with these three quotes, and from there you could build um, moving on because something would click from these quotes may click back and help you remember other aspects of what we talked about today. So first is remember, healing is a journey. It's a process. It's not just a destination. So it takes time. We go through ups and downs. All of that is part of the normal process of the healing. The next quote is in healing and letting go, it's about reclaiming our power and not surrendering it. So again, same thing like when we do the forgiveness, right? Sometimes we feel like if we let go of something, we feel like we would lose it. And sometimes because we are afraid of losing something, then we hold on to the trauma. So, for example, sometimes with people in the military, this happens where they go to war and they experience the loss of uh, a team member. And no matter what they do, they hold on to that trauma because they feel like if I let go of the trauma, then I let go of the person that I served with or the person that I lost. And it is important to understand that letting go of the trauma is only giving us an opportunity to reclaim our power and not necessarily lose the person, but it gives us an opportunity to say, listen, I don't need to only remember somebody by that traumatic event. I have an opportunity now to go back and focus on all the positive things that I've experienced with that person, whatever lessons they've taught me, whatever positive impact they've made on my life. Now I have an opportunity to claim the power that dwelling on that negative event and say I could flip it and say take that same power now and invest it. So the lessons that I have learned from person A or person B, um, I can now share it with a group. I could share it with friends. I could share it with other people who have had similar experiences to what I have had, or similar experiences to what that person have had in their life. So again, in healing and letting go of things, we have that opportunity to reclaim our power and not surrender. And then we utilize that power to help with our own personal growth. And lastly, this is a quote that I really like, and even from personal experiences, um, I feel like this is something that I have dwelled on a lot in the past couple of years. Never let your diagnosis define you, rather allow it to help refine you. And in that way, it's not about making your trauma shape you in being stuck, but it helps you to refine you. It helps you to find that post-traumatic growth. It helps you to look for new possibilities. It helps you for new perceptions, new outlook on life, all of those things. So when we take an opportunity to take the negative experiences that we have and find a way to find purpose in it, find a positivity that happens in it, and then take that and share it, take that and grow from it, is what would allow us to experience post-traumatic growth. So again, I want to say thank you to everyone who have joined and who has listened, anyone who may have shared. I do hope that I was able to touch somebody and make a difference in their life, even if it's a little bit that you joined in, or maybe hearing this even after it's shared. Um, I do hope that somewhere along the line that my presentation today on post-traumatic growth inspires people to reach out for help, to ask for help. Because part of us getting out of fight or flight, getting out of PTSD, growing and healing is getting to that post-traumatic growth. And unless we don't get that help, we are going to be stuck basically in that fight or flight, being stuck in survival mode. And I could tell you that there is a life beyond just survival. There's a life beyond our traumas that we've experienced. And once you get an opportunity to go through it and experience post-traumatic growth, it is something that you would continue to do as you go through life because of that changes in perception, that changes in outlook, all of those things. So again, this month of June is PTSD Awareness Month, Post-Traumatic Stress Disorder Awareness Month. So I wanted to take an opportunity to talk about PTSD, but I wanted to go a little bit further and not just talk about trauma, experiencing trauma, the symptoms of PTSD, etc. I wanted to get to the point where even if you experience trauma, know that it is common. There is a lot of people that experience it. But beyond that, there is that life with post-traumatic growth. And that should be our goal. That should be our objective, to try to get to that point where we do experience post-traumatic growth. So again, like I say, I want to say thank you again to anyone who's listened. Feel free to share this video afterwards. Share comments, feedbacks on it at any point in time, on my pages, so that I could get a feedback on whether this was helpful or not, or things that I could change potentially in sharing information, or if there's another talk that someone might be interested on me sharing my perspective on it, I would be more than willing to do that. So again, thank you very much for all those who have joined in here today. And I do hope that if you've experienced trauma, that you are able to get to post-traumatic growth. And if you've never experienced trauma, I do hope that it stays that way for you. So continue living in resiliency, continue to be thriving as opposed to just surviving, and continue to work towards staying in that growth phase as opposed to getting stuck somewhere else. Take care. Bye.